right, we're going beyond skin deep. We're going right to the skeleton. We're going to be discussing movement, fitness, and bone health basics, why menopause matters, and how to protect your skeleton. Now, this is a very deep topic, in every sense of the word, right? Is bone loss accelerated during menopause, and why is it happening?
Yes, it does.
Yeah.
So according to statistics, it's about 1 to 2% every year. And menopause, as usual, hormones decline, your estrogen, your progesterone. And as I mentioned earlier, your estrogen, what it does is basically, it stimulates the osteoblast, so production. And then the progesterone, literally the osteoclast, it slows down the bone loss. So there's a balance between that. It's a homeostasis. Now, obviously, when we are menopause, it's all depleted. Then we see the impact on our bones, osteopenic, osteoporosis. How to detect? Bone density. So we can do that, at the start of menopause. And, you do it every 2 years just to see how much you're losing. Or, like I have seen patients when they come with osteopenic, and then once they start on hormone therapy, give it about 2 years, it reverses.
It reverses.
It's fantastic.
So, I mean, I always, I know I'm just bringing this up, I don't know statistically, you always hear someone falling down and then they're going to be wheelchair bound and everything. Is it more prevalent with women than men? I know you may not have the facts on you, but I'm just wondering, this is just me observing.
No, yes, you're right. Because when we talk about the estrogen, progesterone, but also there's benefits of testosterone in women. We haven't touched about testosterone actually. So testosterone is, it's a male hormone. Women will require it, a small amount. But that very small amount, it has a profound impact. And it goes beyond the libido.
Okay.
Bone is one of it.
I see.
Right.
So, and that's the thing, right? Because men generally have more testosterone.
Correct.
Okay.
And when you talk about all this brittle bone and all that, you're right. When you talk about fractures, you see it more in women because of the estrogen and progesterone. Now, the testosterone, it also helps when you talk about your muscle mass. We need it for that. We need it for our bones. We need it for our mental health. When you talk about mental clarity, assertiveness, making decision.
Right. That's why how men and women behave as well, right? I mean, so is that clarity and all that?
But it's a small amount, right? If women, we take too much of testosterone, the reverse will happen. We become more aggressive. Then we end up wearing the pants rather than the men. The roles will reverse.
I was wondering, I really must have a lot of testosterone to start off in the first place. I was like, my God, you're going to add testosterone to this? Okay.
But just a small amount.
Just small amount, right? Yeah, I think it does make a difference, right? Now, so we're talking about bone loss, right? So I guess if someone's listening to this, what can we do as early as possible? And I suppose, start in your 30s? What can you do?
Exercise, right? So besides the cardio, start doing your strength training maybe once a week, as little as that. And, I noticed that, the movements is so important. Stretching, movement, because we are going beyond the bones. We're talking about the ligaments, the tendons. We need the stretching. Now, yoga is also good. So to me, just do any sports. Right? That you really enjoy.
Right. Pickleball. Everyone's doing that, okay?
Yeah. Or, even paddle. Paddle is a little bit more challenging, but,
But start with the least strength training now.
Start with the strength training as early as your 30s, because that's when mid-30s already your hormone starts to deplete, right?
Yeah.
And, I think your future skeleton will thank you for all that.
Okay. What about some of the vitamins and supplements we need to take? What is required?
Very important, vitamin D.
Okay.
Because from all the blood tests that I've done, I can confidently say about 80-90% deficient, insufficient.
Okay.
Magnesium is important.
Okay.
Right. The K2, I don't tend to prescribe the, calcium, because you can get that from your diet. And as long as your magnesium is optimum, your vitamin D, and you get a lot of calcium from your gut, it will be absorbed with the K2.
Okay.
Yeah.
And moderate alcohol consumption?
Everything in moderation.
Everything in moderation, huh? Okay. All right. I'm moderate. Okay. What are these DEXA scans, and how early should we get them?
Look into family history. If, let's say, you mentioned like your mom, have you done one?
No, I haven't.
No. Okay. I have to.
Okay, we have to sort it out.
I have to sort it out.
Okay. Sort me out. Okay.
Yeah. So you need to do a DEXA scan depending on your family history.
Huh.
And then start of menopause. So you have a benchmark. You know where you are.
Okay. Okay. So all right. Okay. So so that's covering your bone density.
Yes.
And I think that's important.
And I will always recommend get an ultrasound of your abdomen. Don't forget your breast. You got to self more than doing the ultrasound and doing the mammogram. You have to self breast examine.
Okay.
Yeah.
So again, to prevent bone loss in the first place, hormone therapy were required, regular scans, right kind of protein, that's important.
Yeah.
Weight bearing. I know my personal trainer says, so I've started because of you. I started the whey isolates and everything. So, and I put a little bit of creatine in it as well, right?
Yep.
So to create muscle and all that. So I'm trying to do that twice a week. I feel it's helped me, right? I just feel more stronger. I know that every time you do weight resistance help with my bone, but I think I need to do a DEXA scan to find out where I am exactly.
Yep.
What if we're already behind? Is it ever too late?
It's never too late.
Okay. Tells that to my mother. She's 87 though. It's a bit too late, right? I think in her case. But so talk to your doctor. Like most doctors, you can tell a doctor, I want to do a DEXA scan.
Yes.
Right.
Yeah.
And if they say not necessary,
I think for you to say that you want to do a DEXA scan, you must already know that you already have a certain, whether it's a clinical symptoms or whether it's a family history, and it's also time because of your hormone.
Right. And there's no harm, right, in doing it. So the doctor shouldn't have to say no.
No.
Right?
Not at all.
All right. So important, understanding your bones. Think of it, like always look at your life 5 years from now, 10 years from now, so and be as strong as possible in that period.
Before I forget, can I say something on, because we're talking about scans and all that.
Yeah.
Now, there are another group of women where they would have not been on any hormone treatment and, hormone therapy, and they come to us and they say that we want to start because the quality of life is not good. So women who have already passed 10 years of menopause,
Right.
previously that was an indication, not because there's no protection, right? All the protection happens when you are in the first 10 years of menopause. You start earlier the better, right? Or before 60. That's the indication. But as I mentioned earlier, the latest, the Menopause Journal, if you want to start, but I would actually do a cardiovascular assessment.
Okay. Is this the indication of hormone therapy? What is this? Or does it connect to that?
So if you look at basically when they mention the indication of menopausal hormone therapy beyond 65, the earlier that I mentioned was the vasomotor symptoms, the hot flushes, and then the fracture. It's a cardiovascular disease.
Okay.
Because it reduces mortality across by 19%.
Okay.
And I think it's about 11% of, having a myocardial infarct, heart attack.
Right.
About 11%.
Okay.
So if let's say they come to you, so these are for the doctors and also for, for the public knowledge, you need to do a cardiac assessment before you start the hormones.
Okay, and this is how my dad died, myocardial infarction. So these are the two things that's happening. So sometimes, like I said, why you need to check, because I look at Exhibit A and Exhibit B, right? All these things that we need to look into. All right, thanks so much from just talking about bone density and everything else that connects back to it.